Good morning, everyone. My name is Padma Kamat, and I welcome you to this new webinar of ours at GSCF. So a quick introduction about myself. My name is Padma Kamat, as I already mentioned, and I'm the Regulatory Affairs Director at the Global Self-Care Federation. And we represent manufacturers and associations worldwide working towards self-care products. And we are officially an NGO in relations with the WHO since the 1970s. Couple of housekeeping rules in here. First of all, the webinar would be translated in French, interpreted real time in French, but this only works with the Zoom app. And in order to activate it, you have to go to the webinar controls and hit the interpretation button and select language French or English, depending on when the speaker is speaking on the language of your choice. And you can only hear the interpretation. You have to mute the original audio. In case of any questions or problems that you have navigating with Zoom, please don't hesitate to contact us via chat. We also welcome all your questions to our panelists via the Q&A section, but please note that these questions would be answered during the panel discussion. Finally, last but not the least, the recording will take place in English and we'll share it shortly via YouTube with all of you, with all the participants, but this would only be in English. One change to the program this morning is Mr. Henry Rosas from IQVIA is not able to present due to some logistical reasons today. So we'll try to record his speech as soon as possible and also make it available via the YouTube link. And with pleasure now, I introduce our moderator for today, Ms. Osaretin Jaiola. She's the Managing Director and Principal Consultant with Fensile MHP Consulting, quite renowned, quite very well experienced with self-care products, issues of self-care products, regulatory challenges in Africa. So we are really honored to have her today as our moderator. So Osaretin, over to you.
Thank you, everyone. It's a great pleasure this morning to welcome everybody to this great webinar. Padma, thank you so much. We're going to have a great time today. So before we start, I'd like to introduce our speakers for today. You can see from the panel, from the banner, we have an array of experienced people in self-care. From the Australian colleague who will be joining us later today, to share the importance of literacy through advertising and their experience in the self-care industry. Also, we have with us from the African continent today, we have somebody from Tunisia, we have somebody from Egypt, and we have our colleague from Tanzania. They will also be explaining to us their experience in self-care. Lastly, which would be a good way to start, is that we'll be having somebody talk from the PAGB, where codes have already been established. Having said that, I would like to welcome our panelists today, and I'll be doing a detailed introduction during each presentation. I'd like to say a few words before we start. Now, what is meant by self-care? Self-care, as defined by WHO, is the ability of individuals and families to be able to promote good health, prevent disease, maintain health, and cope with illness or disability with their own personal support, with or without support from a healthcare provider. And for us in Africa, this is apt where the numbers of healthcare providers are a bit limited. Self-care therefore refers to the holistic activities and products, both medicinal devices, nutritional, nutraceuticals, that help people to improve their health and well-being. And this involves making health lifestyle choices, eating the right meals, making responsible choices of prescription or non-prescription medicines, self-recognitions of symptoms, self-monitoring, and self-management. Therefore, we'd like to go on to what is the role of advertising, therefore. And I would like to mention that the pandemic has given us further push to recognize the value of advertising of self-care products. Where we were on lockdown during the pandemic, people couldn't visit their healthcare providers, and access to medicines, especially for mild to moderate ailments, advertising had to play a key role. Advertising is a trusted tool to aid consumer awareness and communication to assist in decision-making for self-medication and self-care. What do I take? What do I do? Is it safe or is it not safe? The role of advertising, therefore, is to create awareness of the product. How can advertising contribute? As a healthcare professional, I will tell you there are many ways advertising can help. And now is the time for self-care. Particularly during this pandemic, COVID-19 has put self-care under the spotlight and showed how advertising is an increasing tool for self-care and self-medication. Just getting out the right message is very critical. Awareness of growth and other regulatory flexibilities have occurred during this time. Having set the stage for a wonderful discussion today, I will say that we would listen to the panelists so that we can therefore begin to understand the right messages. If sent out the right way, we can have self-care and safety for our patients. Thank you very much. Having said that, I'd like to introduce the first speaker to us today. His name is Dion Scombe, is the CEO, Consumer Healthcare Products Australia. He'll be speaking to us today, the importance of advertising for health literacy and consumer education, international best practices, what advertising does and what it cannot do. Thank you very much. Please, you have the floor.
Thank you very much for that introduction, Oseratin. Hello, everyone. In Australia, we say good day, so you can say it in the morning, in the afternoon, and in the evening. So thank you very much for joining us for this discussion. And I would also like to thank the Global Self-Care Federation for the invitation to participate in this discussion. Now, I've been given 5 minutes to share with you some thoughts and observations about advertising. Now, starting with the definition of health literacy, we're talking about advertising and health literacy and how does advertising contribute to health literacy. We normally use the WHO definition of for health literacy, and there are many definitions. But I recently found this one in the context of advertising, which I found quite interesting, and I'll read it to you. From the buyer or purchaser or the consumer perspective, advertising has the quality which enables the individual to select the most useful and suitable product among the various products in the market. Products, of course, that meet the need of the individual. So it's all about knowing what is out there and then being able to exercise choice and making the right choice for a particular condition or for symptoms. Next slide, please. So, advertising, what it is and what it is not. We've already heard that it's all about awareness. So the primary aim of advertising is to create consumer awareness of the availability of a particular product or products. So it could be products that have been on the market for a long time, and it just reminds you of those products. Or it can be a new product which is launched, and then you become aware of this new product. But it has a secondary function. In a market where there are many products with the same ingredients and where many products compete for consumer attention, it differentiates, or advertising differentiates between the different products to assist you in making a decision. When you stand in front of a shelf and there's a lot of product in front of you, you think, oh, I've heard about that one on the radio, or I saw it on the television, or I saw it on social media. Importantly, we also need to consider what advertising can't do. And this is where there's often tension when people want more and more and more information in advertising. Advertising is not intended to convey detailed information. Now, I have to add that advertising has a cultural context. And the example that I use here, in the United States, one of the few places in the world where you can advertise prescription medicines. And you have those who have been there or heard those advertisements They've got go on and on and on about all the side effects. So, I mean, by the time you get to all the side effects, you've almost forgotten what the product is all about. So there is a bit of a cultural element to it. The next point I would like to make is there are many myths about advertising. It's almost as if it's got magic power. Now, some people say advertising induces people to buy products that they don't need. Now, we've done research in Australia which actually indicated that is not the case. But more importantly, there's a concern, particularly amongst healthcare professionals. They say that people will go into the pharmacy and they say, I saw this on television and I want this product and I'm not going to leave until I've got this product, and they want to ignore professional advice. That is certainly not the case, what we found in research that we've conducted in Australia. The last point I would like to make about advertising and its role in the purchase decision. Anywhere between 7 and 15% of purchase decisions have some connection to the advertising. We've not been able, I certainly haven't seen any studies that says advertising resulted in the purchase of a product. There's so much other inputs and awarenesses, family, social media, advertising, what you read, what you heard from friends, etc., etc. So it plays a minor role, but it plays an important role. Next slide, please. So what should be in an advertisement? We believe that at the very least, an advertisement should point the consumer or the patient to the label. The label of a non-prescription medicine is the primary source of information about that product. So it's absolutely essential to read a label to determine whether this product is the right one for your condition or for your symptoms, and then how to use it and how not to use it, side effects, etc., etc. So at the very least, it's important that the advertisement makes mention of the label and the importance of consulting a label. Next slide, please. Now, I would like to share with you what we have in Australia at the moment. We've seen many reforms in advertising arrangements and mandatory statements over many years. On that table, I've selected from 2015 to current, where we started with mandatory statements. You can see all of those. Always read the label, use only as directed. If symptoms persist, see your doctor, healthcare professional. Then what we had in 2018, remember I told you people want more and more and more information in advertising, and that's where we ended up. But after recent reforms, we have ended up with very short statement in advertising, which you can see there. Now, I would really like to commend the TGA for these reforms. These statements are based on consumer research. They've been tested, and we know that they work and they have the impact that they need to have. So if one of the principles or good practices about raising health literacy is to involve consumers in the development of labels and information and messages. So fantastic result here. I really commend this to you. You can look at it in more detail. So thank you very much for your attention.
Thank you. Thank you very much, Dion. Thank you very much for keeping the time. We really appreciate that. So I don't know whether we have Nicole. We'll go immediately to the next presenter for today. We have Nicole. Nicole will be speaking on the, Padma, do we have Nicole online?
Hi, Operator, not yet.
Okay, not yet. So we go straight to Laura then. We go straight to the other one. So Laura will be speaking to us today. Laura is the Senior Advertising Policy and Operations Manager of PAJB. These people have come up, they're an NGO, and they've come up to bring out the codes and how they have helped the consumer. She'll be speaking today on the codes of advertising in the UK. This is a very important starting point and point of reference for our regulators, and particularly for our continent. This will be very important to learn how it has been done in the UK and how we can learn. So now I yield the floor to Laura. Please give us your perspective of today. Thank you.
Thank you very much. It's great to be here today. Thank you for having me. As I said, I'm the head of advertising policy at PAGB. Can we go to the next slide, please? So PAGB is the Consumer Healthcare Association for the UK. We represent the manufacturers of branded OTC medicines, self-care medical devices and food supplements in the UK. Today we'll be focusing on the codes, the consumer code for medicine. Next slide, thanks. So PAGB was created in 1919, so we've been around an awfully long time, and we actually created the first voluntary advertising code for our members in 1936, which precedes any other advertising codes both in the UK and I think internationally. Obviously, since then, our codes have developed significantly. We've got an example here, the one at the front, the Consumer Code for Medicines, is the main one that we advise on. But we also have a whole range of guidance that goes alongside that to go into the nuances and provide advice on how to apply the specific codes. All of our members agree to comply with the PAGB codes, and we cover about 90% of the branded materials in the UK. Those who aren't members still have to follow various other codes, which are reflected in the PAGB codes as well. So the codes are developed and revised by working group members, so that's members of industry, and it's approved by the PAGB board. We also run it past the MHRA, who is the government regulator of medicines in the UK. Next slide, thanks. So a little bit about how the codes are created. So there are various bits of legislation and guidance that are considered when we create the Consumer Code for Medicines. Many of the core rules within it are based on the Human Medicines Regulation 2012. So any legislation that relates to advertising to consumers within that is reflected and expanded upon in our Consumer Code. We also reflect the Blue Guide, which is a Medicine and Healthcare Products Regulatory Agency's document for advertising promotion in the UK. We also have the CAP code, which is the Code of Non-Broadcast Advertising and Direct Promotional Marketing, and that is they're the self-regulatory codes that apply to all different types of advertising within the UK, and that is managed by the Advertising Standards Authority. And we also consider our member feedback. So there are a few rules in there that are about sort of protecting the reputation of the industry, which actually go beyond all the statutory and other self-regulatory requirements. So we consider all of those and reflect all of those in the PAGB Consumer Code for Medicines to make sure that we're giving a really thorough overview of everything that would apply to medicines advertising in the UK. Next slide. So I'm now, oh, apologies, I'll slow down. Sorry, I'm used to talking very fast over here. So I'm just going, the code is relatively long, so I'm going to focus on a few key principles. Like in Australia, we have essential information that's provided in each ad. That's the name of the product, a single active ingredient, if there is one, an instruction to read the label, and a clear statement of the indication of what the product is for. That doesn't necessarily need to be sort of as a footnote. It can be included in the majority of the ad. So we try to avoid excessive amounts of small print. Again, like in Australia, we want to try to get across information in a simple way. In terms of key principles, we need to ensure that advertising is not misleading and doesn't contain any exaggerated claims. Now, these are rules that come from the Human Medicines Regs, but also are reflected in the CAP codes. Material needs to be clearly distinguished from editorial matter. Historically, that used to be fairly straightforward. It would be a case of newspaper editorial advertorials. Oops, sorry, the slides have gone. Newspaper advertorials clearly labeling themselves as ads. But in this day and age, we also have to be clear on social media and various other online forms where there's a lot more ambiguity in advertising these days. We also need to make sure we don't imply medicine is essential and that it is necessary for people to take it in order to get better. Obviously, these products are only suitable for conditions that can be self-treated. So none of these medicines are generally going to be considered essential to health. Next slide, please. So another significant rule that we have is that advertising shall not imply health professional or celebrity endorsement. A particularly interesting case we've had recently is the work of influencers in the UK. So we do not permit the use of influencers on social media for medicines because they could be considered celebrities to their followers. Advertising shall not be aimed either principally or exclusively at children. So anything that is intended for the use by children should be directed towards the parents. You cannot guarantee that any medicine is going to work. And we have to be very careful in the wording that we use to make sure that we do not guarantee efficacy or imply that something is going to completely address symptoms. We always talk about helping to relieve, helping to manage symptoms, things like that. And we do not offer to diagnose or lead consumers to make an incorrect self-diagnosis. So we have to be particularly careful in cases where the condition must be diagnosed by a healthcare professional. For example, things like migraines or thrush, where it can be difficult to tell whether you have that specific condition. We will normally suggest that people go to the doctors first and make sure that in the advertising, it's clear that it should only be used by people who have previously been diagnosed by a doctor. Thanks. Next slide. So in terms of managing these codes, all of our members submit every piece of consumer advertising that goes out to the public to our copy clearance team. So that's everything that has a reference to the brand and goes out to consumers. That's reviewed by a team of advertising compliance execs that we have here, who will check it against the codes and review, make any comments on any changes that are required, and then finally it will be approved, will be stamped, or have approved on conditions, which means that it's approved but needs some minor changes. Now, this sort of stamp is recognised by the MHRA, by the other advertising regulatory authorities, as saying that we have seen this advertising and that can then go out to consumers. And this means we have a framework where most of the advertising that goes out is compliant to begin with. So we have very limited numbers of complaints by consumers. And overall, the system has worked very well. And it's something that the industry is very invested in to make sure that there's an even playing field and that the information that's being provided to consumers is accurate and responsible. Thank you.
Thank you, Laura. Thank you so much for a brilliant delivery there. We appreciate the fact that you've been able to explain to us the codes and the principles behind them. I'm sure the regulators on the platform will be taking some notes, and I'm sure some questions will come to you as well for clarity. Having said that, we're now coming back home to the next top topic this morning, which is one continent, multiple supporting regulatory frameworks. As diverse as Africa is, so as our framework. So we shall be hearing from Dr. Moraz Masood Ali from Egypt. He is the Ali Head of General Administration of Regulation and Marketing and Advertising Materials, Egyptian Drug Authority, FDA. We'll also be hearing from Tunisia as well today, and as well as Tanzania. I will be introducing all the others as they come on board. For the first time now, we shall be hearing from Africa, Dr. Moraz Masood Ali. Thank you very much. Please give your perspective on this webinar. You're welcome.
Yes, good morning, everybody. Does it sound clear for you?
Yes, it is. Please go ahead.
Okay, first of all, I'd like to thank you on behalf of the Egyptian Drug Authority for providing us the chance and opportunity to view our experience as a regulatory system and our role in the area of self-care and patient communication and awareness. Next, please. I will take you in a quick journey to view our experience about three main points. First of all, about our role as an administration of regulating the advertising and marketing materials. Second part on how did our regulations and guidelines facilitate the self-care. And the third part about a new service or a channel for reporting inappropriate advertising materials. Next, please. The general administration of regulating marketing and advertising materials, the main role is to evaluate the materials used for promotion or for education or awareness about any prescription-only medicine or non-prescription medicine, medical device, biocide, or cosmetics to ensure consistency with international practices. Next, please. Our mission statement is to review the promotional materials directed to either healthcare professionals or patients and publics. We issue a pre-clearance or approval for these types of materials before publishing, and to keep an eye open on the marketing to investigate any complaints about any humiliated legislations and to take the appropriate actions. Next. Our vision to be a leading body, a role model in the Middle East, to oversee all the activities involving either in promotional, educational, or awareness materials, developed by pharmaceutical, about pharmaceutical products or medical devices, cosmetics, or biocides, which is disseminated by any means in the media, and cooperate with all stakeholders to promote public health and well-being. Next. The first type of materials we are going to review and approve, the promotional materials, which is sponsored or organized by any marketing authorization holders or pharmaceutical companies. It can be directed to HCPs, patients, or public to promote the recommendation, administration, or consumption of its products. It includes also availability ads and press release, as we are going to view later. Next. The second and third types of materials we review. The second type is educational material, which is intended to provide information about a pharmaceutical product by name or by the scientific name. It does not contain any specific promotion. It can be directed to HCPs or distributed to patients, and can be used also as a part of patient support program. The third type is awareness material about a disease or health condition, and to view any information about the disease for awareness to the public and how to manage this disease. And can be directed also to patients, public, or HCPs. Next. So to summarize all the previous slides, that all types of materials are promotion, education, awareness, or other types of materials such as press release or availability. Next, please. About the format of these materials can be printed, such as posters or flyers or drop cards. It can be electronic by emails or SMS. It can be live meetings or webinars, or videos, recorded videos, or voice notes in the call centers, such as the IVR or the interactive voice response. So we, next please. And finally, of course, the online activities over the social media or electronic websites on the internet. Next, please. So how our regulations and the published guidelines facilitated self-care? As we all know, that the promotional materials have a strongly influence or a strong influence on the physician prescribing. Next, or the pharmacist dispensing. Next. And finally, to the patients and public use of medications. Next. So any malpractice can lead to irrational or misuse, adverse drug events and medication errors, antimicrobial resistance, increased cost and expenditure, drug shortage, especially in the pandemic and the critical situations as we have seen in COVID-19, or about vaccines and rumors about something like ibuprofen and the rumors and the false claims. It has strong influence on the consumers. Next, please. So overall, the provided information should be accurate, reliable, truthful, not misleading, informative and sufficient, fair, balanced between risk or benefit, which is not biased, updated, clear, not confusing, positive in attitude, not panic. Next. So what are the publications made by the Egyptian Drug Authority? We have published guidelines for the non-prescription medicines. We have updated the Egyptian non-prescription medicine or over-the-counter medicines list. We have published prescription medicines promotion guidelines. And finally, next slide. The online activities guidelines, which is guidelines for online promotion, education, and awareness materials activities. Next. All the marketing and an action plan. Next. And the next one was how to use the nebulizer device. It was directed to healthcare professionals and also for mothers and caregivers. Next one. This example is about a TV ad about asthma for mothers and caregivers to raise awareness about asthma symptoms and not to ignore symptoms and when to seek medical advice. Next one. This was directed to patients or for asthma patients. It was an online survey, a web-based survey to self-assess the asthma symptoms and the perception about the use of quick relief of short-acting bronchodilators. It was also revised and approved by us. Next one. One of the most important things is to use the injecting devices, especially for diabetes patients and other types of diseases that may involve injection. Next one. Overall, this is statistics about the all materials we have approved and reviewed during the year 2021 and the first quarter of the year 2022. It's all about the promotional availability ads, awareness, and educational materials. As we can see in the first quarter of 2022, and after publishing the online guidelines, there are many materials about online websites or online materials that's disseminated through the social media. Next one. The final and last thing about a new service provided through the official Egyptian Drug Authority website. It's directed to all people, including healthcare professionals, public or patients, about how to report inappropriate advertising. If I just suspected about any misinformation, I can go to the website and fill a form. Next one, please, for the form. I can fill a form with, I can leave my contact information to communicate, or it can be anonymous for the confidentiality if it is an option. And then we investigate this case and take the mandatory actions if needed. Next one. Our administration and Egyptian Drug Authority has official accounts on all the social media platforms, or the most commonly used social media platforms here in Egypt, such as Facebook, YouTube, Instagram, LinkedIn, and Twitter. Thank you.
Thank you very much, Dr. Moraz Ali, for such a wonderful presentation. Very detailed, showing that Africa is really growing in supporting self-care and through advertising. Thank you very much. I'm sure the regulators online will be taking some notes and questions will be given to you through the Q&A. Once again, I say thank you very much. Now we will quickly move out of Africa continent briefly, as we now have Ms. Nicole Maclay. Sorry, can we have the presentation? Well, we'll be having Ms. Nicole Maclay, the Assistant Secretary of the Regulatory Compliance Branch, TGA, all the way from Australia. We'll be giving her the floor now because it's quite late in Australia. So Nicole, we appreciate you for creating time to stay up to be part of this very important webinar. She'll be speaking about the successful policy perspectives from the Australian perspective, where advertising is an important communication tool and the regulator perspective as well. So thank you very much, Nicole. You have the floor. Thank you.
Thank you very much for having me today. And can I just check that you can hear me?
Nicole, you're clear to me. You're very clear. I can hear you.
Terrific. Terrific. Thank you very much. So thanks again for having me. If we move to my first slide, I'm going to be talking about the Australian perspective. So we recognise that the ability for businesses to advertise self-care products is important, ensuring that consumers have access to information on these products and where they can obtain them. However, regulation of that advertising is critical, as people seeking health products are a more vulnerable consumer group and are therefore more easily influenced by advertising and marketing, much more so than somebody perhaps buying a television. Even for a product such as a vitamin, the consumer may be seeking to treat a very serious condition. So my first few slides outline the regulatory framework or the rules for advertising in Australia. While prescription medicines can't be advertised in Australia except to health professionals, complementary medicines, over-the-counter medicines, and medical devices can be. In relation to over-the-counter or certain products that can only be purchased from a pharmacy, there is a limited range that can be advertised. But all complementary medicines and medical devices can be advertised. The next slide. An important protection that we have in place is that any references to a serious form of a condition, such as arthritis, for example, must be assessed and approved by the TGA before being used in advertising. And because complementary medicines can only be listed on the Australian Register of Therapeutic Goods with indications or claims selected from a prescribed list, this limits the types of claims that can be made in advertising to those that the advertiser has evidence for. And these are important consumer protections. Slide, please. Our legislation also allows us to issue an advertising code, and that includes the more prescriptive requirements for advertising, such as what mandatory statements and health warnings must be included. It also states that an ad can't be misleading, inaccurate, or claim that the product is safe or miraculous, or a similar claim like miraculous. Slide, please. We've taken some deregulation measures over recent times, including abolishing the requirement for the pre-approval of ads, and we now only require health warnings to be provided at a point of purchase. So in relation, those health warnings can be read on the label of the product. In relation to online advertising, it's only at the point that a purchase is being made where the health warnings need to be produced. In addition, when we consider whether to issue a permission to an advertiser to use a reference to a serious condition, again, such as arthritis, we consider whether to issue the permission to all advertisers of that product. That ensures that all advertisers can use that claim because we've assessed that it is a valid claim and maintains a level playing field for business. Something that we focus on as the regulator is our investment in all aspects of achieving compliance, and that's the diagram that I've included there at the bottom of the slide. Our education efforts for both industry and consumers, which include guidance, fact sheets, media releases, and the like, are as equally important to us as our enforcement actions. My branch covers the full spectrum of education initiatives, compliance work to bring people into compliance with the regulatory requirements, enforcement where we need to at the very pointy end. If we can skip to the next slide. And perhaps if we go one more slide, please. Thank you. Some of the concerns we have in the compliance enforcement space, I'll stay on this for a moment, however, include advertising of goods that are not on the Australian Register of Therapeutic Goods and therefore haven't been assessed by the TGA and there's no processes. And the advertising of products on social media and marketplace platforms by advertisers that aren't familiar with the rules or are even willfully not following them. This requires new techniques for us as a regulator. It requires us to build strong relationships with the platforms to ensure that the rules are being enforced at every level, that there is a level playing field for industry, and that there's consistent evidence-based information for consumers. Again, we do support there being an availability of information for consumers on self-care products. Finally, I'll just touch on two further points if we can go back to the previous slide. We recently conducted consumer research in relation to the consumer's understanding of the mandatory statements that we require in advertising, such as always read the label and follow the directions for use. The research found that there was a good understanding of over-the-counter medicines and medical devices, but this was a much more limited understanding amongst younger people. It found that there was a wide range of attitudes to using self-care products. However, there were some negative attitudes in there, such as overconfidence and carelessness. The research found that the behaviours that we'd like to see are not being consistently adopted. For example, only 33% of consumers surveyed confirmed that they always read the label. Only 38% considered the product for their particular circumstances, and 54% followed the usage instructions. However, a large percentage of those surveyed agreed that mandatory statements are really important, and they send a signal to the consumer that a regulator has been involved, and this provided them with a level of comfort. In response to the research, we have simplified the requirements for mandatory statements in advertising. There are fewer of them, and they've been simplified, and we will run a consumer education campaign on the behaviours that we'd like to see consumers adopting when they purchase self-care products. And we'll work with our creative folk in the Therapeutic Goods Administration to come up with a slogan for that campaign. So we believe that if we use a simple mandatory statement, but educate consumers on what to do when they see that statement, we can be more effective. And next slide. And just my final point, I realise I don't have too much time tonight. Another important part of our framework that I'd like to share with you is the Therapeutic Goods Advertising Consultative Committee. This committee has representatives from the therapeutic goods industry, health professionals, consumer representatives, media, and government. The committee meets 3 times a year and advises the TGA on a range of advertising matters. And we've found this committee to be really helpful in helping us with advertising policy, advertising education for industry consumers, and also where needed, our compliance and enforcement approaches. That's the end of my presentation tonight. Thank you very much.
Thank you, Ms. Nicole. Thank you so much for giving the TGA's perspective. Yeah, we have learned a lot, and one good thing you just ended with is the consultative committee that helps to guide this kind of program. I'm sure people will take note of that. Having said that, from the continent of Australia, we would like to go back to the presentations from the African continent. We'll be taking questions at the Q&A session. So if you have any questions for Nicole, please do make good to put them in the Q&A session or write them down. Or if you have questions to previous presenters, please put them down. There are lots of clarifications that the regulators on the platform, they want to clarify from Nicole as well and how they have evolved. Having said that, we'll quickly go to the other continent now in Africa. The other speaker from Africa will be calling on Dr. Ali Bislai. from Tunisia. He's the chairman of the Tunisian National Colleges of Pharmacists. He'll be giving his perspective from the Tunisian perspective. Dr. Ali, please. Is Dr. Ali's presentation up?
Merci.
Merci.
Bonjour tout le monde. Je voudrais tout d'abord remercier Global Self-Care Federation pour m'avoir invité à participer à ce webinaire. Je salue tous les participants. Mon intervention va concerner l'expérience que nous avons vécue en Tunisie durant la pandémie de la COVID en rapport avec l'impact de la communication sur la prise en charge des malades.
That there is an opportunity to listen to the English version by touching your translation button at the bottom so that you can follow the Tunisian presentation very well. Dr. Ali, sorry to have interrupted you. Please go ahead.
Merci.
And talk about
Merci. Mon intervention va concerner l'expérience que nous avons vécue en Tunisie durant la pandémie de la COVID en rapport avec l'impact de la communication sur la prise en charge des malades et le rôle joué par les pharmaciens durant cette pandémie. Je parle de communication parce qu'il faut dire qu'en Tunisie, la publicité proprement parlée n'est pas permise, même pour les médicaments qui ne sont pas à prescription. Elle est seulement permise pour les produits de santé tels que les compléments ou les produits de parapharmacie. La communication grand public constitue un moyen efficace pour promouvoir l'éducation sanitaire des populations pour une meilleure prise en charge de leurs problèmes de santé en général et plus particulièrement ce qui est de l'automédication responsable et sécurisée pour un meilleur accès aux soins, c'est-à-dire le self-care ou l'auto-soin. On va voir que pour ce qui est de la communication, pour ce qui est de la stratégie en matière de lutte contre le Covid, les responsables de la santé en Tunisie, revenez en arrière s'il vous plaît, en arrière s'il vous plaît, oui voilà, ont eu un choix, à faire un choix pour quelle approche utiliser et prendre, ou bien une approche centrée sur le système, c'est-à-dire envoyer, utiliser les moyens de la santé publique, ou bien une approche centrée sur les patients, et alors que cette deuxième approche qui avait toutes les chances de réussir, étant donné le climat qui est favorable, à savoir l'accès élevé aux médias de la population tunisienne, 82% de foyers ont une télé, une grande pénétration, un taux de pénétration de 67% pour l'Internet et bien sûr les téléphones mobiles aussi. Et puis une grande couverture par les pharmacies à travers tout le pays à cause du numerus clausus, le quorum démographique et géographique. Et bien sûr, il y a un comportement ancien du consommateur tunisien pour l'automédication, c'est-à-dire le self-care. Seulement, les responsables politiques ont choisi une approche plutôt centrée sur le système, à savoir utiliser seulement les grands centres, les grands hôpitaux et les grands centres spécialisés pour justement le traitement de cette pandémie. Et cela par manque tout d'abord de connaissances. Nous avons appris sur le tas, c'est une nouvelle maladie. Et puis, le recours systématique, bien sûr, aux hôpitaux, la rareté des ressources et une tendance naturelle à la centralisation qui existe dans tout pouvoir. Ce qui fait que la COVID a été gérée en troisième ligne, c'est-à-dire dans les centres nationaux et régionaux qui ont vite été dépassés. Diapo suivante, s'il vous plaît. Nous voyons ici la situation justement qui a généré ce choix, à savoir que tous les hôpitaux et les institutions publiques ont été vite dépassés. Le diapo suivant, s'il vous plaît. Par la suite, et après que cette stratégie est arrivée si vous voulez, à son terme, il y a eu un changement de stratégie, une création d'une commission de communication au ministère de la Santé pour préparer justement toute une campagne de communication On a préparé des affiches dans les 3 langues, des spots télé, radio, préparation des SMS d'information et de sensibilisation, des questions-réponses, création et gestion des sites web coronavirus, en collaboration bien sûr avec la présidence du gouvernement. On a préparé le chatbot Aziza qui répond aux questions. Les citoyens, ils entrent, ils posent leurs questions sur le Covid et puis ils sont mis, on leur répond immédiatement. Un professionnel de santé leur répond. Des SMS, bien sûr, de suivi des personnes en auto-isolement ont été bien sûr envoyés et des questions-réponses aussi. Diapo suivant. Diapo suivant, s'il vous plaît. Voilà, justement, cette stratégie sur le terrain s'est traduite par un changement d'offre de soins. On est passé du choix des hôpitaux universitaires et des centres spécialisés à la première ligne, puis à la première ligne publique, puis à la première ligne privée, c'est-à-dire les cabinets de médecins généralistes, les pharmacies et les laboratoires de biologie. Ça a justement offert un autre choix, une autre possibilité aux patients de se soigner, de se prendre en charge eux-mêmes. Diapo suivant, s'il vous plaît. Cette stratégie qui met le patient au centre, voilà, maintenant on leur a offert plusieurs alternatives, soit les centres de vaccination publics, soit la première ligne publique, soit pour la biologie, c'est-à-dire les laboratoires, ou les premières lignes privées, et essentiellement la pharmacie qui a l'avantage d'offrir plusieurs offres de soins, c'est-à-dire les pharmaciens, ils font de l'orientation, les malades, ils ont eu beaucoup de travail, ils ont fait énormément de travail pendant cette période, notamment l'éducation des populations pour adopter le bon comportement et le bon geste, la dispensation des soins bien sûr, et le tri et l'orientation vers d'autres professionnels de santé. On a fait aussi le diagnostic rapide avec le TROD et même la vaccination dans les officines. Justement, pendant cette période, on a remarqué une augmentation sensible sur la consommation de médicaments de prescription et une grande sollicitation pour le conseil des pharmaciens. La pharmacie est devenue, si vous voulez, la première destination, surtout au moment de confinement, il y a eu pratiquement beaucoup de cabinets de médecins qui ont été fermés. Donc, le seul recours pour beaucoup de patients, surtout dans les régions, c'était la pharmacie. Et ils ont joué un rôle, les pharmaciens ont joué un grand rôle d'éducation et justement de conseil pour surtout soit du tri pour envoyer pour les cas graves, soit de prise en charge carrément pour les cas bénins. Et on a vu une augmentation très importante de la consommation des médicaments de conseil, c'est-à-dire OTC-like. Même si la publicité n'est pas permise, les citoyens tunisiens ont justement accès aux moyens aux réseaux sociaux. Et sur les réseaux sociaux, il y a justement une publicité sur beaucoup de produits. Certains étaient peut-être de bonne qualité, mais beaucoup étaient prétendaient des effets bénéfiques, mais c'était des médicaments, c'était des produits plutôt dangereux et le pharmacien a joué un rôle justement pour sensibiliser les citoyens pour prendre ce qu'il faut comme traitement et non pas se laisser berner par la publicité mensongère. Suivante. Oui. Là, on voit l'effet, une statistique sur l'effet de la campagne de communication pendant 4 semaines. Vous voyez là, la première semaine du 15 octobre 2020, c'est le lancement de la campagne animation lors de la journée mondiale de lavage des mains. La deuxième semaine, publicité radio et spot TV diffusé à l'échelle nationale, ajouté contenu de digital sur une base bi-hebdomadaire. La troisième semaine, c'est le contenu digital, etc. Donc, le résultat de cette campagne, c'est 87% des personnes interrogées ont trouvé les messages du gouvernement tunisien sur la COVID et les recommandations sanitaires claires, une hausse de 3%, une hausse de 9% du nombre de Tunisiens qui respectent les recommandations sur la distanciation sociale, une hausse de 4% du nombre de Tunisiens portant des masques. Plus de 1,5 million de Tunisiens ont suivi ces campagnes de publicité. Là, nous voyons justement les posts les plus performants en Facebook. Vous voyez là le nombre de visites. C'est un nombre très important. Ça, c'est calculé sur une semaine seulement. Diapositive suivante. Diapositive suivante, s'il vous plaît. Les enseignements qu'on peut tirer, c'est que durant la COVID est passée d'une maladie gérée exclusivement au niveau central, c'est-à-dire dans les structures de troisième ligne, à une maladie gérée en première ligne, notamment en officine, grâce à une communication multicanale ciblée et continue. C'est justement ça a favorisé les self-care responsables. Responsables parce que c'est le contrôle des pharmaciens, c'est le conseil des pharmaciens, parce que le self-care ne doit pas non plus être pratiqué de façon sauvage. Il faut qu'il y ait un professionnel de la santé, en l'occurrence le pharmacien, pour justement le canaliser. La réussite de cette transformation est tributaire de l'implication, bien sûr, des pouvoirs. Pardon, s'il vous plaît, revenez à s'il vous plaît. Diapositive suivante, s'il vous plaît. Voilà. Création d'un cadre, il faut une création d'un cadre légal justement pour la commission de prise en charge, la clarification du cadre légal. Malheureusement, en Tunisie, actuellement, on n'a pas un cadre légal pour ce qu'on appelle les médicaments conseils, le statut OTC. Ça va justement permettre encore plus la prise en charge en mode self-care et va libérer des ressources pour les autres pathologies et réduire le fardeau sur le personnel soignant et les patients consommateurs. Le rôle de l'officinal a été renforcé pendant cette campagne et qui représente quand même un pilier du système de santé en Tunisie. Le projet que nous discutons actuellement, que le Conseil de l'ordre justement prépare avec d'autres intervenants sur le médicament conseil, consiste justement à mettre un cadre légal pour justement encadrer pour encadrer le self-care et permettre une publicité à visée éducative pour le grand public, sous réserve bien sûr d'une autorisation du ministère de la Santé après avis favorable du Conseil de l'ordre des pharmaciens. Voilà ce que je suivant. Ce qu'on peut tirer comme enseignement négatif, c'est justement l'absence de ce cadre-là réglementaire pour les médicaments conseils, permettant une communication directe aux patients sur les maladies et ses traitements disponibles et une meilleure implication des pharmaciens a ralenti la transformation de la prise en charge de la COVID. Donc, c'est ce que je disais tout à l'heure, qu'il faudrait accélérer la mise en place de ce cadre-là. L'absence de cadre réglementaire pour la pratique de la télépharmacie, justement, et de l'ordonnance électronique, ça a beaucoup ralenti l'accès. Le gouvernement a voulu justement tenter une expérience pour le traitement des patients COVID à domicile, incluant bien sûr les médecins avec la télémédecine et la pharmacie. Malheureusement, ça a été freiné par l'absence de ce cadre de télépharmacie, de ce cadre légal. Autre chose, le démarrage tardif de la campagne de vaccination dans les officines et le manque de communication du ministère de la Santé et le choix aussi de la population cible a limité son impact. Merci beaucoup.
Thank you so very much. Thank you so very much. Thank you for our presenter from Tunisia, very well presented.
Merci.
Sorry.
Oui, merci.
Okay, merci aussi. Thank you so much, merci. So from his presentation, he has highlighted a few key things that I believe that will guide us as we make decisions in Africa. There were key lessons from the COVID-19 in Tunisia, that responsible communication leads to self-care. And a legal framework is very important to facilitate self-care. Those are two key things I picked from there, as well as the lack of communication actually slows down the access to treatment and good treatment in the environment. So having said that, we quickly run to the last presentation for the day, and who will be speaking to us today is Dr. Raymond Bondio from Tanzania. He's the Senior Technical Advisor for PSI Tanzania. He'll be giving his perspective from Tanzania. Thank you very much. You're welcome, Dr. Raymond Bondio. The floor is yours. Thank you.
Thank you. Good morning, good evening, good afternoon, everyone. So this is Dr. Raymond Bondio, a medical doctor and public health specialist from Tanzania. And I'll be taking you through the consumer awareness for HIV self-testing experiences from the STAR project in Tanzania. Next slide. So in terms of the background, I'll take you through our organization background, the PSI, then a snapshot of PSI Tanzania self-care implementations, and then narrow down to HIV self-testing, which is usually a recently self-care component and HIV portfolio. Then we take you through the PSI HIV self-testing implementation under the STAR project as well. Then lastly, on the consumer awareness and communication for HIV self-testing implementation Tanzania. Next. So about the Population Service International PSI, we are the international non-governmental organization based in Washington, D.C., and operating in over 35 countries, including Tanzania, where I'm based. Our main mission is to make it easier for the people to lead healthier lives and plan for the families they desire. We are also a social market-led organization. And in Tanzania, we're implementing various programs with the focus on HIV, malaria, sexual and reproductive health, as well as WASH programs. Next. So for the PSI Tanzania and self-care, we have been implementing various self-care related interventional programs, including the access to emergency contraceptive pills, but also misoprostol access for the post-abortion care in the country. Also, the HIV self-testing services through workplace and pharmacy distribution, which will be the main component of these presentations. Next. So when it comes to HIV self-testing implementation, in Tanzania, there's a milestone for that. Before 2019, in Tanzania, it was not allowed for persons to do the self-test for HIV self-testing. So the introduction of HIV self-testing in Tanzania mandated to change the existing law through the parliament to allow the introduction of the self-care, the HIV self-testing in Tanzania, which was done through the Parliament 2019. Then comes in the development of the National HIV Self-Testing Framework for the implementation of the HIV self-testing, just 2020. Then we have National Registration and Regulatory Authority, which is Tanzania Medical Devices and Drug Authority, the TMDA, which is the main regulator authority in the country for all the drugs and medical devices, including the HIV self-testing kits in Tanzania. Then we started the scale up of HIV self-testing services in the country back the year 2020. And when it comes to social and behavioral change communication for HIV self-testing, this is guided mainly through the National Health Promotion Unit under the Ministry of Health. The HIV self-testing is currently considered as a screening test and not a confirmatory HIV testing. So a person who has undergone HIV, who has undergone self-test for HIV, need to do the confirmatory test through the routine or conversional testing. Next. So in terms of the HIV self-testing implementation under the STAR project, this was the catalytic investment funded by Untitled from the February last year up to June this year. And the objective of the program was to create an enabling environment for the scale up of HIV self-testing in Tanzania. The HIV self-testing distribution to client through various models, including the workplaces, which including the formal and informal work process, but as well as engagement of private pharmacies in 4 regions of the country. Next. So for the consumer awareness and communication when it comes to HIV self-testing uptake in Tanzania, we are using various approaches. One is interpersonal approaches, where this is a peer-led model for demand creation for the workplace distribution. So through the informal and the formal workplaces in the 4 regions that we're implementing, we've identified the peers and we've supported them through the Ministry of Health. The training are the ones who are generating the demand for the HIV self-testing. But also we are using the trained community health worker for demand creation for the pharmacies. These are the trained community health workers who are supporting the demand creation in the catchment areas of the private pharmacies who are distributing the HIV self-testing kit as well. And also for the pharmacy model, we have trained the pharmaceutical personnel who, as well as apart from the distributor, but also they are creating demand for the potential targeted HIV self-testing consumers. Next. So also there's a use of media. Currently we have a national targeted IC materials to supplement the effort of interpersonal communication. But also the use of mass media, radio and TV spot currently developed. But also we are in the very exploratory phase to see how we can engage the social media as well for the consumer awareness and communication when it comes to HIV self-testing in Tanzania. Next. So these are overall cumulative achievement for the project started back May 2021 up to March 2022. Overall, we have through the pharmacy model, we've distributed around 17,000 kits for HIV self-testing, but also through the workplace, we've distributed around 95,000 kits for HIV self-testing. But also we have done some a campaign and we've managed to distribute around 2,000 HIV self-testing kit. Next, I think that should be my last slide. Thank you. Thank you.
Thank you, Dr. Raymond Bondio, for giving that perspective, particularly speaking from the African Tanzanian perspective, whereby HIV test kits, people can know their HIV status by themselves before going to the. This is very innovative and it's wonderful. So we're going to open the floor now for Q&A. Thank you once again, Dr. Bondio. We're going to open now for panel discussion, and I'm glad to tell you that even our Australian presenter is still online. So we're going to begin to take questions, not in any particular order, but as I find the questions, I would identify those who can take it. So the panelists be ready, and if you have not yet sent in your questions, please, you still have opportunity to send in your questions to the Q&A. Any clarification you need, any more information you need, you have an opportunity to put it up now. So I will just check with Laura. We can just go on now. I'll have a few questions from the participants, particularly to for the TGA. For the TGA, that's for Nicole. Consumer research. How did it influence your framework, consumer campaign on advertising? What's the protocols used? That is, how are you going to do it? And for how long and what information will you be communicating? I hope that question is clear. I would like to take it again. Nicole, can you hear me? How did it influence? Yes. How did the consumer research you did, how did it influence your framework, consumer campaign on advertising, the TGS framework on consumer advertising? What's the protocol used? That is, how are you going to do it? How did you do it? How long? And what information were you communicating?
Thank you very much for that question. The research was conducted in the lead up to us issuing the new version of the advertising code, and that's the 2021 advertising code. So the research was used in determining what the mandatory statement requirements would be, and we used the information that we gathered in terms of setting the mandatory statement requirement for always read the label and follow the directions for use. So that was the statement that resonated most with consumers. And so it was used in setting the code as part of our framework. In terms of the education campaign now, what we want consumers to think of when they see that statement, we're just in the very early stages of designing that campaign. So we plan on running it in the middle of this year towards the last quarter of this year. We're likely to only run it for probably 3 to 6 months. And we'll be using as many resources as we can. So for example, in terms of getting the campaign messaging out there, we'll go to the members of the Therapeutic Goods Advertising Consultative Committee and ask them to share campaign products. So whether it's social media posts that we produce, whether it's articles we write for people's newsletters. So if you can imagine the Pharmacy Guild of Australia, who's on the committee, we'll write an article for them to put in their newsletter, or a social media post that they can use. Then we'll also look at whether we can, and in that way it becomes quite inexpensive when we partner up with media companies and health professionals and so on. But we'll also look at buying some screen time for screens that play in doctors' surgeries. Television screens will pay for some advertising on those screens. So we haven't come up with our slogan yet, but it could be something like read, write and review. So read the label, write, is this product right for you? Review the dosage, monitor for symptoms. So maybe a read, write, review slogan. But look, we're just in the very, very early stages, but we want it to be catchy and gain some traction for consumers.
Thank you very much. I'm sure the question hasn't well dealt with. I appreciate you. Yeah, but the research had some impact on the framework and you're planning the campaign for the future. I want to remind all participants that this webinar is being recorded and to be available later in case you need more clarification on the question. Once again, thank you, Nicole. I'll quickly take some questions for Laura. We have a couple, like 2 questions before I move on. Question 1 for Laura is, how does the PAGB work with the MHRA, the statutory regulator for medicines in the UK? We know that the PAGB is an NGO. How does it work with the UK? I would quickly add the second question so she can take both together. How does the PAGB deal with complaints if advertising the team has approved? Is there a disciplinary measure? Is there a way to deal with it? So Laura, if you don't mind, please could you take those 2 questions together? How does the PAG work with the MHRA, who is the statutory regulator in the UK? And how do you ensure that there's discipline within members? How do you deal with complaints when they're coming? Thank you.
Thank you for that. So we work quite closely with the MHRA and we have a very good working relationship with them. The MHRA does recommend that companies that are bringing out over-the-counter medicines are members of PAGB, and we work with them in various departments, both on regulatory issues and with the advertising team. For example, when a new over-the-counter medicine is launched, we will discuss with them the claims that can be made, and often have meetings to look at where to draw the line on those. In terms, they also review all of our guidance and then give feedback, occasionally to attend meetings with us. So it's a very positive interaction as well. And they have limited capacity to deal with sort of issues regarding to OTC medicines advertising. So they're generally quite happy to have us to pick up some of the work there. In terms of complaints, luckily we have very few complaints in this sector, mainly because of the pre-approval system. Where there are complaints, some internally, so if a member has a complaint about another member, we will look to liaise between them and try and keep it within the industry rather than public. Where it's a complaint from the Advertising Standards Authority or MHRA, we will usually get involved at the beginning to help the member defend their advertising and explain why we believe it's in line with the codes. In the rare circumstances where there is an upheld complaint, we will have a look at our systems and have a look at the positions we've taken and decide whether or not those need to be amended going forward to make sure that we're aligned with the regulators.
Thank you, Laura. I hope you've dealt with the questions. I will just highlight the response there. There is some work sharing with the MHRA from what I can hear, rather than use the little resources they have. They've given you that opportunity to have some guidance and codes to guide the population and the industry. So I can hear some work sharing there. And there are statutory codes to deal with area members and how to deal with it. Okay, the details of the responses you will find in the recording. Thank you, Laura. I'll just quickly take some more questions. We'll now go to the Egypt HA. There is a question here for you. What do you assess for webinar material? Do you assess for information to be used in HCP webinars? Please take note, the Egypt HA. There's a question here for you. What do you assess? What do you evaluate for a webinar material? Do you then look at the information that is going to HCAs as well? Thank you. Dr. Moraz, please, can you take that question?
Hello, for the,
Should I repeat the question?
For the question about the webinar materials?
Yes, please.
What do you exactly assess?
Yes,
the information
please.
Presented through online meetings or webinars should be compatible with the regulations, to be clear, to be accurate, to be updated. If an agency or marketing authorization holder is going to hold a webinar or a live meeting, they will submit us the material hyperlinked with the references, and we are going to review it, and issue an approval before it can be used and published or recorded. Is it clear?
Yes, it's very clear. It's very clear. I wish we would have a situation where we have in the UK as well, where we have a PHGB who would take that burden off you, so you don't have to go through the whole hog. But it's very nice to know that you review all the materials, the webinars that have been put, whether they're accurate and they are according to what is approved. Thank you very much.
We also have a monitoring system and a monitoring unit to keep an eye open in the market and in social media, and to detect any materials or live meetings, so we can call the agency or the marketing authorization holder to get back to us and gain an approval.
All right, thank you very much. They also have a monitoring team that would naturally go through that. Thank you very much. Yeah, I will just go on to a few more questions. I have a question for the Tunisian speaker, Dr. Ali Bislai. Has the consumer or patient campaigns done by Tunisian government increased the desired compliance to OTC medication? I'll repeat that question again for Dr. Ali. Has the consumer and patient campaigns done by the Tunisian government increased the desired compliance to OTC medication therapy? Dr. Ali, please. Dr. Ali, you have the floor.
It's just Dr. Ali Bisla from Tunisia.
Yes, please.
I guess we have a bit of a lag because the French translators might be translating it for him.
For him, okay, no problem. So we can go on to the next question and I'll come back to Dr. Ali again. Is that okay?
Yes, sure, sure.
Okay, I have a question again for Dr. Moraz. Dr. Moraz, you can't leave now. You have another question that since you're here as a regulator, in the context of Africa, where resources have to be used judiciously, we all know that resources are scarce in Africa. Will you be, as a regulator, be open to sharing best practices with other regulators to avoid a certain advertisement being accepted by one regulator and rejected by others? Like this, we ensure streamlined regulations on advertising. Just watching your several examples you gave, I was really fascinated how you're taking out adverts to educate the population on different disease states. Would you be willing to share this experience with other regulators in Africa where we have limited resources? What I mean about work sharing, sharing best practices, will you be willing to do that and to avoid certain advertisement being accepted in one part of the region, in one part of the continent, and then being rejected by another? Dr. Moraz, please. Dr. Moraz Ali.
Okay, thank you for the question. Before we publish or propose a regulation, we first of all see what the other best practices, and we don't invent the wheel. We just take from credible resources and then customize to our situation in our country. As an example, for the online guidelines, we have taken some codes from the Australia and the Canadian and the MHRA, and then customized it to the situation in our local market. That's the first of all, the first thing. So any regulations we did not invent, as I explained. The second thing, we can share this experience with the Middle East or North African, as it is close in the market, and the products are extremely close between Egypt, Tunisia, Algeria, Morocco, and some of the North African countries, and we can disseminate later to include all the African countries as needed.
Thank you very much. This is very important. And thank you so much, Dr. Morazali. Thank you for agreeing to share this good experience, particularly now where we're having the African Medicine Harmonization Initiative growing in Africa, and the evolving to become the African Medicine Agency, AMA, is in development as well. So it would be very good to see an African regulator sharing best practices with others, particularly where we have limited resources. And I thank you so much for agreeing to do that. And we would expect that, just like you have said, you have taken online guidelines from Australia, from MHRA, from the Canadian, and adapted it to your own. It would also be nice to see other African regulators take your guidelines, look at them and adapt it continent-wide, so that whatever is happening in Egypt is also happening in West Africa, happening in East Africa, happening in North Africa, as well as South and Southern Africa. Thank you so much for your response. I think I can now go back to Dr. Ali Bislai from Tunisia. Is he ready to take his question now? Oui.
Oui, est-ce que vous pouvez
OK, continuez. Allez-y.
Est-ce que vous pouvez me reposer la question, s'il vous plaît?
OK, d'accord. Has the consumer and patient campaigns done by the Tunisian government increased the desired compliance to OTC medication therapy? You shared with the panel, with the House, that your government...
Oui, bien sûr, de façon directe et indirecte. Tout d'abord, en faisant participer les pharmaciens à la prise en charge des pharmaciens pour les malades Covid. Et bien sûr aussi à travers les réseaux sociaux, bien que la publicité n'est pas permise pour les médicaments OTC, seulement elle existe dans les réseaux sociaux. Et on a vu une augmentation très forte de la demande justement des médicaments conseils et une sollicitation beaucoup plus grande du pharmacien pour la dispensation de ces médicaments et pour la prise en charge justement. Oui, c'est certain. On avait beaucoup d'augmentation de médicaments symptomatiques, d'utilisation symptomatique pour le Covid, la vitamine C, le paracétamol et tous les produits, le zinc, etc. C'est indéniable.
All right, thank you so much. That shows that putting an ad and information out to the consumer definitely has an important role to play in self-care. And the Tunisian example has shown that even though it was COVID-19 related, the over-the-counter medicines were able to grow as well and get more information across to them. I think what we'll be waiting for is a strategic framework, the legal framework, so that more of this can happen more and the pharmacists can have more charge in that situation. Thank you, Dr. Ali Bislai, for that question. I have a few more questions before we... Merci bien. So I have one more question to Laura. Laura, we need a clarification, please. Can you explain more about approvals with conditions? Remember, this is, yes, Laura, please, can you clarify approvals with conditions?
Yes, of course. So as we established in the UK system for PAGB, all advertising that is directed at consumers currently has to be approved. One thing that we do to ease the amount of admin and resubmissions is approve on conditions, which means that if there are simple changes to be made, we will say, you can consider this as approved, provided you do X, Y, Z. So it's normally something simple, like if they had forgotten to add always read the label, they could add that on and it would be approved. It just saves them having to send it in again and go through the whole process.
Okay, thank you very much. That means you can't just take an ad and change it overnight after it has been approved.
Exactly, because with the approval system, as you can imagine, a lot of advertisers want to move very quickly. So it can delay stuff if there's a lot of back and forth. So we try to make it as quick and efficient as possible.
Okay, thank you very much. I have another question for Dr. Dion Scumby. Please, where do you see the future of advertising going in terms of health literacy? Can something more be done to ensure better education? This is very critical for us in our continent. So you'd like to take that question, Dr. Dion? Where do you see the future of advertising going in terms of health literacy? Can something more be done and ensure better education? I'll give some examples we saw during the COVID-19 in our continent. Everybody was eating a lot of ginger, a lot of garlic, because we believed on social media there were lots of things going around that can take away COVID from our continent. So how do you, what do you see the future of advertising going here? Thank you.
Thank you for the question. Look, an interesting question. I'm not sure that advertising will change dramatically. I think it's an evolutionary process. And I think Nicole made some very important points about consumer education. First of all, I think the task is to get our messages right. There was a time, and I go back 10 years, where people sat around the table, excluding consumers, regulators, industry, healthcare professionals, etc., and they decided what advertising codes should look like. And there wasn't much input from consumers. Fast forward to today, where the TGA did some truly progressive work in the space of consulting with consumers to determine what messages resonate with them and what messages will change behavior. So I think it's a combination of things. What we've got to do as an industry, constantly look at how we can improve our labels through consumer testing. Then there's also the education piece, and we all need to be involved in that. The regulators, as Nicole pointed out, the campaigns that they thinking about at the moment, but all stakeholders have a role to play in creating constant awareness. Behavior only changes if you reinforce behavior. So we've got to do it on an ongoing basis. The task of health literacy is never finished. So it's ongoing and constant, and it's got to keep up with consumer expectations and needs. I hope that answers the question, but I can't quite see revolutionary change. We may see things like, for example, social media made a big difference in promotion and advertising. It also presented new challenges in controlling and regulating those different media, particularly from a point of view where there's, like it in the UK, mandatory pre-approval, and other parts of the world, mandatory pre-approval of ads. So to design the code to keep up with that, codes need to be living documents, and they need to change as technology and consumer literacy changes. I hope that answers the question.
That does, but I have a rider to that. Maybe you need to make some clarification. Knowing that in Africa we have limited resources, how do we fund, from your experience, health literacy campaigns? Is it funded by industry? Is it funded by governments? Where should it come from? Because the literacy level here is a bit lower than what you expect in Europe, and therefore the ability to read labels and things like that. How do we ensure that this reinforcement and continuous campaign continues? Where does the funding come from?
We've just released, or we're about to release, a white paper about health literacy. So GSCF, the Global Self-Care Federation, and its members have been talking about self-care and advocating for the adoption of self-care in national health policies. So what we've been trying to get people is to recognize the value of self-care. The main driver, to advance self-care, we will have to raise health literacy. There's a direct link between the level of self-care and the level of health literacy. So we've now embarked on strategic focus on focusing on health literacy, and we've about to release a white paper. And in one of the statements in that paper really is stuck with me, and that is health literacy is everybody's business. So the doctor, the pharmacist, the educator, industry, the regulator, consumers themselves. So we all have a role to play in health literacy, and our space is specifically self-care literacy. What are the skills, the knowledge, the information that consumers need to practice responsible self-care, to select products and services appropriately. So it's a big task, but I think we've all got to be engaged in it.
Thank you very much. What a way to round it up there. What I'll say, what resonates with me is that self-care health literacy is everybody's business. Is everybody's business. So for the panelists, for the participants, for the government, for everybody, is everybody's business. I'll quickly just take one last question before we go. And that is for Dr. Bondio. Dr. Bondio, you have a question here which says, in future, do you plan to use the model of HIV/ST to other domains of self-medication or self-testing or self-treatable conditions? If yes, which ones? Also, how do you seek help, approvals from the Tanzanian Health Authority? If I may take that question again, Dr. Bondio, Dr. Raymond Bondio from Tanzania. In future, do you intend to use the model of the HIV/ST to other domains of self-medication or self-testing or self-treatable conditions? And if yes, which ones? Also, how do you relate or seek approval from the Tanzania Health Authority?
Okay, thank you. I think that's very clear. So in terms of the using the HIV self-testing model for other product, I think I've measured currently the number of other medical products which are using almost the same model, including the misoprostol distribution for the post-abortion care, but also the emergency contraceptive pills, but also, yes, these are currently the product which are using the HIV self-testing model. And we are expecting, as I said, we're expecting to currently to scale up this model widely for HIV self-testing, but as well for the other product for the self-medications. On the case of regulatory authorities, currently Tanzania, we have the national drug and medical device authorities, which is a mandated body by law to register and regulate all the medical devices and the drug in country, which are produced in country, but also which are imported in country. Thank you.
Thank you. The question was, do you seek approval from them?
Yes, you should. Actually, you should be approved. And for the product like HIV self-testing, the first criteria was the product should be WHO pre-qualified. I think currently we have only one product which is oral based, but recently there are a number of other products which are blood-based are coming in the country, which are already WHO pre-qualified. So soon in the portfolio of HIV, when it comes to self-testing, we're going to have a number of products apart from the current one, which is currently on the scale-up phase. Thank you.
All right, thank you very much. Do you have to pass your communications to them for approval as well?
Yes. Yes. Also for the product, there's a regulatory process through the regulatory authority, but as well for the communication material, there's also a promotion unit under the Ministry of Health as well, which you have to go through and review your materials and get approval before they are shared to the public.
All right, thank you so much, Dr. Bondio. Thank you for clarification. We have just 10 minutes left and this webinar is getting more exciting. I have just one last question, and that is to Dr. Moraz of the Egyptian authorities. Just a very last one, and please be very quick because we're closing the webinar now. What impact have OTCs and approved advertising had in the behaviors of Egyptian patients and also in terms of product sales? Now that you have this kind of, what impact have OTCs and approved advertising had in the behaviors of Egyptian patients and also in the terms of product sales? If you can quickly just take that in 1 minute, I would really appreciate so we can round up.
Okay, do you ask about the impact of OTC ads?
Yes, on the patients, on the Egyptian patients, as well as in terms of product sales. Has this had any impact on the general public in Egypt, and what kind of impact have you seen?
Okay, in order to accurately answer this question, we need to make a research about this impact, or a huge market. And as we can take now for measures such an impact is of reporting through the official website, either about the adverse drug events by OTC products, and this was encouraged by the disclaimers we mentioned. The second thing is the rate of reports that has dramatically increased to the official website about inappropriate ads, and the legal actions we have taken either to close. We communicate with the Supreme Council of Media to just control and close any unofficial or inaccurate web pages or websites on the social media, or to direct the marketing authorization holders to get back to us and to submit their material for review and approval.
Fantastic. That was done in 30 seconds. That is great. We have had a beautiful webinar today, and I want to use this opportunity to thank all our panelists who have done justice to not just the presentation, but as well as the Q&A. The discussion will continue on as we continue in the continent. I want to say a big thank you to all our presenters for this. As closing remarks, I will just make a few observations, and then we can hand over the conclusion of this seminar. We can close. For us, self-care, the future of self-care has just begun, and for our continent, it is so apt at this time of this, particularly the involvement of COVID-19. Self-care has become ever more important, with individuals taking control of their own health, both during and beyond the pandemic. Now we can see that people can go on social media, find out what they want to do, and begin to trade. However, advertising plays a very crucial role now in the post-pandemic era, in the future, to support the well-being of the health coverage, universal health coverage globally. I would like to say here that global knowledge transfer for a better global health is critical. We need to ensure that we together support a more efficient healthcare system by experiencing and transferring information that is correct to avoid mistake. We need to ensure that the actors take full responsibility in keeping the people informed. We saw from the presentation, people talked about guidelines, regulations, monitoring. In short, I really liked Nicole's presentation. She talked about 3 areas that are very important for self-care: education, compliance, and then enforcement. Actors need to take responsibility. We need to see digital healthcare and telemedicine in a very increasing way, but however, in a responsible way. People need to be empowered, but empowered in a knowledgeable way. The individual access to healthcare professionals currently is increasing, but is limited, particularly in Africa. Not everybody can see a doctor. Not everybody can see a pharmacist, but people are seeking information in their own way, either going to see the doctor, the pharmacist by the side, or going to see even their cousins or their brothers to get more information. Therefore, we need to ensure that communication of the right information is available to them. They do not have access to the wrong information. Where are the areas, therefore, where advertising can help? Advertising can help in changing the landscape. Today, we have WhatsApp, we have Zoom, we have Teams. Tech and digital healthcare is now more important. The second way advertising can help is individual empowerment, self-care literacy. A colleague from Dr. Dion mentioned about health literacy being linked to self-care literacy. Very, very important. Advertising can play a key role, particularly in areas like in Africa, where the literacy level is low. We can demonstrate through responsible advertising how medicines can be used. And lastly, self-care is a building block for universal health coverage. health promotion, non-communicable diseases, ensuring that people understand and know why medicine can be taken in a safe way. Next slide, please. On that note, I'd like to say thank you to everyone who has taken out time to participate in this webinar today. And I would like to say a very big thank you to you. And the discussions have been very, very, very useful. I'll hand over now to Padman to do the final closing. Thank you all.
Thank you, Saratin. That was excellent. You did a fantastic job, and really thank you to all the speakers. And especially our Australian colleagues, because it's quite late at night. So thank you everyone for the brilliant presentations, the brilliant discussions, and we look forward to welcoming you to our next webinar. Thank you.
Thanks everyone. Goodbye.
Bye. Thank you everyone. Bye.
Bye. Bye.
Thank you. Bye everyone.
Thank you. Bye.